3, 2, 1.
Well, today we have Dr. Prashant Kumar and he's practicing in Ranchi, Jharkhand. We're going to be talking about OAB because that is a very prominent and very important problem these days. Very welcome, sir.
Thank you. Thanks a lot.
Very first question which I'm going to ask you is, can you describe this for the audience viewing this, that what is an overactive bladder and how does it impact the quality of life?
Basically, this OAB, which is actually overactive bladder, it's not actually a disease, it's a symptom complex. Like disease is such that it can be treated, it cannot be treated. But OAB is just a symptom complex. It need not be treated at all with medicine. Many times it has been seen that with behavioral changes and with diet or some other basic changes, we can treat it. So basically, impact on life is actually very distressing, because symptom wise, if you see, patient will have too much urgency for passing urine. Many times it leaks. So social inhibitants and all those things are very important in this disease. Once it is, the patient might be dry, might be wet. So wet kind of disease or symptom complex, it is very distressing for patient. So I think it needs to be taken care of by a urologist.
Well, when you were talking about behavioral changes actually, so I would like you to put some light on the term which is called behavioral therapy. What is it?
I think that's very important question, and people need to understand this. Suppose many people will come and say that, sir, I pass urine at increased frequency of micturition, like I am passing very oftenly, every 5 minutes, 10 minutes, 15 minutes. Very few patients will come and say that I am passing in half an hour or 1 hour, because they will accept the quality of life. So if you ask them that, sir, what is the amount of water are you taking? So everybody will say, sir, doctor साहब ने बोला है you drink a lot of water. So this is a very fine gap between बहुत ज़्यादा water and normal water. So people start drinking liters of water, 4 liter, 5 liter, 6 liter, to have a good life. But actually speaking, if you drink more of water, you will pass more urine. It's a common thing. And the patient who are having very frequent urination of 5 minutes, 10 minutes, we say them that go and pass urine actually on time basis. So we call it timed void, and drink water on a time basis. So take fluid timely. It should not be like one time you are taking 1 liter of fluid and after 4 hours you are taking 1 glass, and after 4 hours you are taking 1 liter. So basically, behavioral means whatever we are doing in our daily basis, first we have to change the scenario. Like drinking water itself is a scientific thing. So how much and when to take, and when to pass urine, how to pass urine, this all thing needs to be ascertained that it's going on a correct path.
Right. Well, any advice for the individual who are suffering from OAB and trying to lead a normal life?
If you are suffering from OAB actually and it is diagnosed, definitely go and consult a urologist. Whatever he says for a medicine, you just take those medicines. If they are saying for behavioral changes, do that as quick as possible. And whenever you are going for some outing, do carry some extra clothes. If get wet, and the wet cloth needs to be deodorized by putting them into some boric acid or those kind of homemade detergents and all. So I think more than sufficient, and just follow orders what your doctor is saying. Restrict the water intake.
Well, thank you so much, sir, for your valuable times.
Thank you so much.
You.